So welcome back. Now we're starting chapter 2, treatment options for PTSD.
Wonderful. Yes. Excited to be back. And this actually is a wonderful continuation, because I feel like now we've kind of given you, here are all the characteristics from chapter 1. What is PTSD? How do I look out for it? What can happen? And it's no wonder it's complicated. No wonder it's hard to necessarily know. And once you've really kind of, maybe there were enough yeses during chapter 1 that you were like, maybe there is something going on. And I could, which is hopeful. That is hopeful. That's like, oh, there's opportunity here, and there's things that I can do. And so what can I do? And that's really what chapter 2 is all about. And so where do we begin? So I just want you to, kind of take a second. And this really is an opportunity to validate what it feels like when you are in the throes of post-traumatic stress disorder. There is panic, there is apathy, there's these, we've been talking about these continuums and these swings. It's not just all being overwhelmed and, or feeling like everything is threatening or being incredibly anxious. There's also this sense of hopelessness and apathy and numbness. There can be difficulty sleeping. There can be a loss of, pleasure in the things that you once loved, or just really feeling, getting to that helplessness phase of having thoughts of death or suicide because you just don't know what else to do and there doesn't feel like any other options. So I wanted to kind of give you all an analogy for trauma treatment. And I feel like, so many people come to me and they're like, I want to do trauma work. And that is, I find it is like this elusive idea, like, well, what is trauma work? What are we going to do? And how are we going to do it? And so I thought I wanted to kind of make this a simple metaphor, which is like a house. And so the first thing is we've got to lay the foundation. So if we are going, a wonderful mentor of mine, kind of described it as this: we are going to be, kind of building a bonfire, and we're going to be sitting closer and closer together, really kind of experiencing the things that have caused you a lot of suffering and a lot of pain. Well, in order for us to be able to do that, we do want to ensure that we have effective regulation strategies and skills to use to help effectively cope with this. Because we don't want to kind of go and start to use maladaptive coping, which is like self-harm, substance use, eating disorders, avoidance, other things that could really become threatening for you and your recovery. Then we want to start to validate your experience. So validation of, you starting to learn how to validate your own experience. Also hearing someone else validating your experience is a huge ingredient and component to building this house. And challenging your problematic beliefs. That problematic belief can really cause a barrier to your ability to recover from your PTSD. Because if you really truly believe it was my fault, I'm a bad person, I am weak, right? These kind of absolute truths that are incredibly negative and do not see, the whole picture or you as a whole person, that can really be a problem in also your recovery, let alone the feelings that you have in your PTSD. And then starting to work through our fears, which means learning how to face our fears. So we do have to start to kind of re-experience and relearn how to be in life, that there's a lot of uncertainty in life and there's a lot of risk, that we're taking, like even getting to know someone is risky. And then post-traumatic growth occurs. This is where all of that hard work, starts to sprout out. And you really do, clients have described it as like, it's freedom, it's finally this freedom of the shackles of their PTSD, of really starting to feel as though they are experiencing life. They're having more of a rainbow of, experiences. And it really does start to feel as though, okay, I can handle this. I have a full, brick and mortar ability to walk through life today post my trauma. So what are the active ingredients of really effective trauma work? Building and maintaining an effective therapeutic relationship. You really do need to have that therapist that you trust, that you feel connected to, that you really have, you see this as your partner, and the person who's going to be there as your guide, as your support, and also someone who you trust or that you're building trust with. Trust is hard to know for sure after trauma. Relaxation, self-regulation skills. That's where we're back to that base. We really do need from the ground up, how do we relax our bodies? Because like I was saying, our bodies are so tight. And especially with post-traumatic stress disorder, we have to teach it how to relax and open up a little bit. I always use this example of the hedgehog. Do you know what a hedgehog is, Neil?
Sure.
And so they're very cute. They're so cute, right? So here's this little hedgehog, and the hedgehog has these quills on the outside. And so when it rolls up, the quills come out, even though it's this very, very little thing. And when it relaxes, it actually opens and turns over onto its back. And it has this incredibly soft belly. And so when we are working in trauma and working with trauma as a therapist, we want to be very respectful of the fact that the individual is mostly their body's going to want a hedgehog. It's going to want to show its quills and cover that soft belly because it feels way too threatening to become that vulnerable. So relaxation and self-regulation skills is slowly reteaching the body, hey, I don't always have to be showing my quills. I can actually start to show my soft underbelly and I won't be hurt. Exposure therapy, really starting to those low risk situations where, our bodies and our minds are telling us that it's a high, there's actually high risk there. So for instance, if going to the grocery store is incredibly overwhelming for you and it feels like there's so much stimulation, so your body is telling you this is a dangerous place. Well, through exposure therapy, because we know a grocery store there's a lot of things that are safe within that grocery store. And there's a lot of things, the likelihood of risk is low. So we can actually do exposures in this grocery store and how to really kind of get back to being able to tolerate a grocery store again and what benefit that would have for the client. And the other side to this, so exposure therapy is about, yes, it is, going and facing our fears and challenging them. But then we have this other side, which is behavioral activation, where we do want to have pleasurable experiences. We do want to, kind of relearn how to enjoy self-care, that being in a bath, and relaxing in a bath or listening to, calm music or having a really good conversation with a friend or getting a job, all of these things are positive and they have great, wonderful contributions to our lives. And with PTSD, we can actually start to reduce these positive experiences in our life. So we have to relearn how to bring them back in.
So behavioral activation could be more about what are things that maybe I used to enjoy and getting started with some actual activities, maybe something physical, maybe something social.
Yes. Yeah. And that's how we will begin. Absolutely, is how to get back those things. And that's where that post-traumatic growth really exists, is to kind of grow the positive experiences in our lives. And then cognitive reprocessing. So this is where we start to rework, re-understand the memories related to our trauma. So this is where we're normalizing our experiences, we're normalizing our symptoms, but we're also going to start to work on correcting our perceptions of safety. So where are we kind of overestimating risk or overestimating threat in our lives, and that's actually causing more of a problem for us. And then providing psychoeducation, just why our body is doing what it's doing and how do we start to work with our body when we're having a flare up, so to speak, of becoming triggered or overwhelmed or, kind of feeling as though that impulsive behavior is taking over.
So does this part of the therapy, the cognitive reprocessing, is this mostly happening when I'm talking with my therapist?
So this actually leads us to the next one. Yes. So this can be done in many different ways. So it's really up to you as the person who is seeking the treatment. What way do you want to do it? So how can you reprocess what has happened to you? So you can do it. Here are some evidence-based trauma treatments that are available to you. There's written exposure therapy that kind of has 5 different sections that you are just writing and kind of following these guides and really kind of learning and exploring your trauma through that way. Or prolonged exposure therapy, which is verbal. That is where you are actually going to be finding what traumas you want to be targeting, and then going through and reprocessing them. So through imaginal exposure, where you are retelling the memory, and then recording the memory and listening to it, and then your therapist is there to kind of support you through that. And that's something that I'm trained in, and same with written exposure therapy. And eye movement desensitization and reprocessing, also well known as EMDR, that actually has a nonverbal component to it. So you're not verbally processing it, and instead you're working with, kind of the eye movement. So we're doing bilateral eye movement stimulation while then thinking through particular prompts. And then there's also ways in which there's regulation strategies, and there's ways to help with, your body's reactions and your emotions and thoughts. But it has less to do with what you're verbally processing, and more kind of how you are going to be thinking through it just within internally. So cognitive behavioral therapy for trauma, it's similar to prolonged exposure. There's also some written components to it. Same with cognitive processing therapy for trauma. There's some verbal and some written as well. And supportive treatment, so things that you can do along with, or that your provider is also aware of, which is trauma-informed care. So how to kind of support someone that we know has gone through trauma, and that's more of a systems approach. And you'll see that more when you kind of go to an organization. They say we're a trauma-informed organization, or we're a trauma-informed group. And so these are the things that we value, or these are the guidelines that we have because we're a trauma-informed group. Exposure and response prevention, which we talked about in the last slide. And that's really where we're learning, PTSD is not usually just related to the traumatic event. Then, like I was saying before, then we start to have other fears in our daily lives. So for instance, I had a client who just even hearing the clicking of heels down the hallway, that even caused a trigger for that individual. So that becomes very disorienting if that person ever heard it, right? So then we start to kind of work on that. So we're noticing moments or other types of things that in their lives that cause triggers. And we start to target those and do exposures around them to reduce that overwhelmed feeling. And dialectical behavior therapy, which we're talking about here as a support and a way to really build the base and how to kind of build off of that, and the treatment the modules in which were created for that. And acceptance and commitment therapy, which is wonderful as a way to start to challenge those thoughts. So through thought diffusion, values-based living, building a life beyond your trauma and after your trauma is a huge component of that post-traumatic growth. So when once we've kind of decided that we want to do a treatment, there are some really important components to asking ourselves about: when do I start the actual reprocessing of my trauma? Now, it's the final component, the actual reprocessing of my trauma. When am I ready for that? That is where we want to look at, okay, do you have any life-threatening behaviors such as suicidal ideation, self-harm, high-risk substance abuse, high-risk eating disorder? is there anything happening currently or in the last 2 months? It would be effective to stabilize those.
Okay.
So kind of it goes in line with the next one, which is that you can start to show your ability to control your life-threatening behavior in the presence of intense cues for these behaviors. So you're not necessarily going to those extremes, continuing to recreate these really life-threatening, behaviors, or using them impulsively, using them to a point where they would be a harm to you. And instead that you are showing your ability to tolerate distress, in other words, and using regulation and coping and your skills and, versus using these other behaviors to help you cope and regulate. Next one, which is their ability or willingness to experience intense emotions without escaping is very hard for them to do, or they don't really feel like they have enough, practice doing that yet. Then we can, before we do the reprocessing of trauma, we can actually do some, experience some other intense emotions, things that may cause you extreme sadness or extreme fear, or, so we can come up with a different type of exposure and just see, okay, let's practice tolerating this. And to get us prepared for then the practice or the tolerating the trauma reprocessing. So post-traumatic stress disorder is the highest priority target. We have identified this. This is the decision from both the client and the therapist. Then the client gets to decide if we move forward with the PTSD treatment. And the therapist is there as the guide and offers advice as to, okay, well, let's go back through and ensure that we have all of these components that we just discussed. And make sure that we're really ready. And do we have that foundation? And ensure that, the next step forward will be successful. And sometimes, so there is still a very high percentage of dropout in trauma treatments. And this is really the problem that researchers are trying to solve. Like, what is it about, what happens when we've identified that PTSD is really the disorder, and that there's treatments available, and so then we start the treatment, and why does the patient either not want to start it or drop out from the trauma treatment after a certain, usually around like 4 to 5 sessions. And so some of the things that can happen is like the problematic beliefs are not changing. They really feel like I am bad, no one believes me, I'm worthless, that those feelings really start to take over, or it really feels like, the fear of challenging those really starts to come up. Over engagement. So we've been talking about over and under engagement. And that is where we are feeling overwhelmed, dissociating, struggling to manage our emotions and urges. These physical arousal, these feelings are over, it's like the lava is boiling out, right? The under engagement is that numb, that apathy. It's almost like the individual is talking about their trauma like it's the news report or the weather report. There's no emotion attached to it. You don't necessarily feel any sort of, like, nothing really comes up for you as you talk about things. And you just kind of feel disconnected, detached, and you don't really feel motivated to work on it. That's where we can become under engaged. And unjustified emotions are not changing, such as we feel ashamed because this happened to us, even though it's, we had no control over it. We have this really strong amount of fear, and we're really struggling to see that actually going down in intensity. Feelings of guilt are not shifting. Self-directed disgust, feeling self-disgust, and that just remains really high. These are some indicators that the person could be at risk of dropping out of treatment or feeling as though the treatment is not working for them.
So one thought that comes to my mind, if I'm having one of these experiences that you have on the slide where I'm not continuing with my trauma treatment, that doesn't seem to be helping me, what idea that comes to my mind is, well, maybe what is going to be helpful to me will be going back and focusing on the foundation.
That is correct.
And that's what we're going to talk about. So this will wind up chapter 2, and we look forward to seeing you back in chapter 3, where we're going to learn about building this foundation through dialectical behavior therapy.